This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic.
Well, welcome to another episode of the Grow My Clinic podcast. My name's Jack O'Brien. Lovely to be with you today. And we have a guest with us. We have Stephin King from Movement Assessment Technologies, or commonly known as Matt. Steve, how are you today?
Very good, Jack. Thanks for having me.
My pleasure. Let's dig into it, and we'll get straight into your story. We'll touch on the Matt stuff later and your podcast and all sorts of different things. But first of all, let's learn a little bit about you. I think you would be considered unique, I guess, in the positive sense, in the sense that you're a dual qualified professional, dual qualified therapist. Do you want to run us through your background a little bit, where you studied and what your credentials are?
Yeah, I guess unique's probably one of the nicer things I've been called over the years. So that's okay. I don't mind being called unique, Jack. So look, my background is, I went straight from high school. I actually got into masters, or bachelor and masters of arts and commerce. So I decided I wasn't quite sure if that was for me. So I took a year off and went and lived in Italy for a year. Living in a little medieval hilltop town where no one else spoke English.
Yeah, that must have been tough.
It was tough. Picked up my language skills very well, but along the way I sort of realised, look, the business aspect for me probably isn't, where I wanted to go, which is quite ironic now what I see myself doing, 95% of the day. But I decided for me that wasn't the pathway I wanted to take, and I always had a passion for sports, had a passion for the body and for health. And so for me, I ended up doing my bachelor and masters in osteopathy for 5 years at Vic Uni.
Right.
I got out of that course and I realised that there was something I was missing. While I was working as an osteopath, I was working as a personal, while I was studying as an osteopath, I was working as a personal trainer.
Sure.
And I really struggled to take those patients who I was, training and put them on the treatment table. And then those patients that I was treating on the table when I graduated from osteopathy, I had trouble getting them moving again. So, look, I got a little bit disillusioned. I sort of went, looking for something else. I think that's pretty common in those first few years out of practice. And I went back and did my master's in physiotherapy at the Uni of SA. So I packed up all my bags, moved from Melbourne to South Australia for a couple of years, and hoping that would help me bridge the gap, which it did. It helped me a little bit in regards to movement, but mainly in regards to clinical reasoning, communication, and obviously pain science with the NOI group being based there. But it probably still didn't quite satisfy the needs that I was looking for. So I went back traveling, went over to the USA, went over to the UK and did a lot of movement-based courses there. And that started to bring it together for me to, where I am now.
Yeah, right. Interesting. So let's touch back on that history. I think a lot of practice owners and listeners of this podcast we're all health professionals, but we get that frustration, that friction, that tension that leads us to either buy a business or start our own clinic. How far into your osteo journey was that friction where you decided to do something?
Yeah, so I realised that was pretty early. That was in the first sort of 12 months of being out in practice. Right. I couldn't see myself being stuck in this little 3x3 treatment room forever. I knew that, I'd started looking into, starting up my own practice or, going back and doing a master's in strength and conditioning. But then I ended up in physiotherapy, and I get 2 or 3 emails a month now from other graduates in the first typically 2 to 3 years out who have similar issues and similar feelings in the practice. It wasn't that I wasn't working in a great practice. Like, I was working with some really good people, some good mentors who probably didn't have the time when I was there to be able to mentor properly. And I probably found, like, being on your own in a little treatment room without a lot of support, a lot of guidance around you, I couldn't really see a pathway forward in osteopathy.
Sure. So why a physio then? Some would say that's blasphemy or the like. Why physio?
Yeah, definitely crossed to the dark side, as most of the osteos lots of my osteo mates like to remind me. Look, for me, I saw it as a way. It had, there's lots more career options. There's some good pathways in place, I think, in physiotherapy. It's much more established, and
sure.
I think the APA does a good job in regards to setting up some of those pathways. For physios, whether it's sports or whether it's a neurological. Whether it's going into the hospital space, there's lots of different avenues. For physiotherapists. Who probably don't come out of university at a higher level as the osteopaths. This might be a little bit controversial.
I've heard you mention that before. So that's around like clinical hours and level of expertise, essentially?
Yeah, exactly right. So, especially in regards to the musculoskeletal space, I think physiotherapists come out, we've had a few start with us over the last, 12 months or so, and they've had 5 weeks of placement. They're lucky to have seen, 10 patients over that time. Sure. Whereas the osteopaths come out with, 5 years of musculoskeletal specific study. And I've seen over 200 patients and done 2 5-hour clinic shifts a week for the last 2 years of their course. So there's a huge difference between where the university finishes for physiotherapy when the university finishes for osteopathy. But I think then once they finish, physiotherapy has that pathway to take people, beyond that study and really build a career.
Sure. And so it sounds like then you packed your bags again and gone traveling all around the world, and with a real flavour on assessment movement type stuff. What was the motivation behind that?
Yeah, look, the movement-based stuff was probably the thing that attracted me at first, but I realised, look, you can do all this great movement-based, approach, but I felt like I was still guessing. I didn't really know if my patients or clients were actually getting better.
Sure.
So that's where I started looking a little bit more into assessment. And I realised, back when I was, got out from osteopathy, that I really struggled, those assessments that I'd been taught through osteopathy, which are similar to physiotherapy and lots of other professions, very table-based, very isolated. They're not really looking at movement at all. And there's a big gap between, again, what we're doing in assessment and then what the person's going out and doing in the field. So I started to look a lot into functional performance testing, different ways to test strength and power and balance and look at functional movements and those type of things. And that started to really, spark my interest, I guess. And I was lucky at the time that, one of my, colleagues, my business partner now, Andrew Lemon, sort of had similar feelings. And he was really looking to, start to move into that space as well, start to, differentiate ourselves from from other therapists out there, but also just give ourselves a better understanding of actually what's happening with our patients and clients.
And at this time, did you have a clinic of your own, or you were working in private practice at all?
No, so I was still working in private practice. So I'd finished my physiotherapy masters then. I'd moved back out of Adelaide the next day.
You wouldn't be the first one.
No, probably not. So I moved back to Melbourne, worked in a practice, busy, multidisciplinary practice, but just felt that I was quite limited by, one, the treatment times. They were treating on, 20-minute schedules, which, in my opinion, you can't really achieve a lot in. And didn't really have a setup beyond that, 3x3 treatment room again to be able to take patients further. I felt that I was taking someone's coming in with pain or, dysfunction. I don't like that word necessarily, but that pain or dysfunction. And, they wanted to get back to their activities that, they need, want or love to do. And I felt that I was only getting people, and patients a certain way along that spectrum in that environment. So I wanted, we eventually decided we wanted to create an environment where we could take people a little bit further.
Okay. And so you do all this learning, you pull it all together. And I think like a lot of us, our method of practice is a conglomerate of all the different learnings that we've made across the journey of professional development. What led you to bottling that up into what is now movement assessment technologies?
I guess it came from a few of our colleagues, sort of wanting to know. We initially, started drawing on a yoga mat. I think a lot of people will know us from the mat, the movement assessment tool. A lot of people, a few of our mates just said, that's a pretty good idea. You can see how you're improving the way people, balance or the way that they lunge or squat or their flexibility. And they wanted to know a little bit more. So we thought, there's a little opportunity here. We'll run a little course for 10, really close colleagues that we went through university with. And then off the back of that, they went and told, a few people. And so we ended up running a course, 3 or 4 months later for another group of, a small group of 10 to 12 people. And then over the course of the year, we decided, let's have a try in a couple of other markets. So we went up to Sydney and went back over to Adelaide as well. Mm-hmm. And then, fortunate enough, someone spotted us on social media over in Asia and got our sort of first big break over there, invited us over there. And we started to see that, there is a need for this. People are having the same feelings that we were both having in our practice, and that it really, helps people with their clinical reasoning, what they're doing, and hopefully gets, more of their patients better by actually being able to tell objectively whether people are getting better or not. And we also found it was getting great buy-in for our patients and clients.
Yeah, that's interesting. That's exactly where I was going to go with the next question. We might circle back to the side hustle, what's become a fairly big hustle of the mat now. But if we come back to that client experience, creating something like the mat and your assessment approach, how did that differentiate you in the eyes of clients? Because do clients even care what assessment tools we use?
Definitely not. No, most of the time they don't, they don't know what they're going to get, when they walk into a practice, I think, and definitely when they come into our practice, they just know that, there's something a little bit different, I think is what we often, get told about our practice. But, I think patients just get it. Like using, we're big on using objective data, collect as many numbers as we can. And that just allows you to communicate better with patients in a language they, understand, rather than you talk about all these different postural things, or you start to talk about these muscles, not activating, again, not a phrase I like, and all these, things.
Some people could see you making the inverted commas with your fingers.
Yeah, but look, I think therapists traditionally speak a language that patients don't understand. I think numbers are a way that enhance the communication, and they just start to get it. They can see the big discrepancies side to side. You can then use the latest data from the literature to back up your decision making and help to educate them about it. Mm-hmm. It really makes it easy for them to get on board with your treatment and your management plan.
Sure. I think there's a couple of important elements there when it comes to assessment tools, whatever approach you use, that you would communicate in ways that make sense to the client, right? We're about creating experiences for clients where they understand their diagnosis, whether that's pathological or psychosocial. So using language that matters to them and something that you can retest with them that they understand. It creates amazing buy-in, right, at the start of their journey. But then also having something that differentiates you as a clinic. We're often dealing with patients who have been to multiple clinics before, different professions, and so having something that stands out, that makes you different, is really important as a clinic owner. So let's come back then to the Matt journey, Steve, and it blew up in Asia and all this sort of stuff. So how do you as a clinic owner manage running your own busy clinic and also having something on the side?
That's a good question. I think I'm still learning a lot about that, to be honest. But we're lucky that there's two of us in a partnership. I think we've got a partnership between myself and my business partner Andrew Lemon that works really well. We both probably got our strengths and our weaknesses, and we sort of know where each other sits and what each other's passions are as well. And so I think that works really nicely. Then the fact that, especially over the last 12 months, we've been able to give each other pretty definite roles. Mm-hmm. To help, strive everything going towards the direction that we want it to go. Yeah,
sure. And so tell us a little bit more about the mat.
The mat itself. Okay, so the mat started out just a simple, tool. We started drawing some lines on a yoga mat, measuring all three dimensions of movement, basically. So being able to measure the distance, the angulation, and the verticality of any movement. And sure. Then we started looking more into the research, and there's lots of great evidence-based tests out there in the functional performance testing realm that you can use to collect data in the clinic. So it's really just a simple, portable, easy way to get, for me, pretty meaningful data to help your clinical decision making, make better decisions about when people can return to work, return to sport, and allow you to set evidence-based rehabilitation programs off the back of collecting that objective data, and then gauge that effectiveness over time to motivate people and keep them engaged.
Okay. And so it's a tool that clinic owners can do the course and then grab the product at the end that allows them to have a really smooth, tailored assessment approach for their clients. Is that right?
Yeah, exactly right. And we've today we've just released our new KneeMatt Pro App as well, which allows us to collect data, help to improve the communication. It has some little flags and triggers on there to let you know when someone's falling outside the norms that we might see in the literature, or into some of those higher risks of potential injury. A lot of people like to think and predict injury. I think we're a bit naive to do that. But it definitely allows you, in the app to then flag those individuals where you might want to put an intervention into place. And then, for us, we want to try and save clinicians as much time as they can. We know it's often difficult to do that. So off the back of that app, it automatically programs, the best rehabilitation exercises to, help your patients get to where they want to go.
Yeah, sure.
And allow them to log in, track their exercises over time, to keep them engaged in the rehab process.
So you've got a patient-facing side and a clinician-facing side, essentially.
Correct.
Yeah, great. And so what's the feedback from patients? What do they think about having this extra, when we say extra, outside of the consult room experience?
So, for us, it's been a new way for us to engage patients. I think we often, found that, sometimes the retention, I think a lot of practices struggle with retention rates and people dropping off the management program once they start to get that pain phase. And they start to get, 2 or 3 or 4 sessions in, I think is probably the average rebooking rate for physios. But sure. Again, I feel just getting someone out of pain is great. but it's often not getting them, building them robustly enough to get them back to what they want to do for their daily lives. So allowing them to be able to communicate with you. So through the app, they can communicate, with you by sending instant messages or emails. And you can do that as well. Each week you can log in and you can check how well patients are going with their progress and start to ping them to say, hey, look, I notice you haven't done too much this week. And they really love that little bit of extra feedback, that extra level of service, which I know, is something big that you guys are about at Clinic Mastery.
Yeah, for sure. And I love that it doesn't really matter what the tool is, whether it's your app or PhysiTrack or some other app. The point is that we're creating experiences for patients that mean we can help them get the outcomes they want, and also the information education. Like you say, how often as clinic owners do we get patients back to maybe out of pain, but not to optimize their performance? Or I love that word robust, around creating healthy individuals that are, robustly performing whatever it is that they need to do. That's a great experience that you're creating for patients. Tell me, is it just physios and osteos that are using movement assessment?
No, so we've got professionals from over 10 different professions now using the mat. So, from chiropractors, physiotherapists, osteos, as you mentioned, podiatrists, EPs, we get massage therapists, sports therapists, athletic trainers in different markets. So there's lots of different professions who are speaking the same language. And I think that's what data allows us to do. It doesn't matter what data you're collecting, as long as it's, you think it's meaningful to the patient. But that helps you not only communicate with yourself over time, but also when you're working with other healthcare professionals, and starts to get everyone, speaking the same language. We're off to, over the next couple of weeks, off to 9 different countries with, I think, 7 different languages in that time. So you've got people, with data enhancing the way, I can communicate with this pretty strong Australian accent to people all over the world.
Yeah, I love it. Okay, that's fascinating. 9 countries will be a whole lot of fun, no doubt. But can we come back to your clinic, and let's make this super relevant for clinic owners? How do you, and you mentioned that you've had a few new and recent grads come on board, how do you straddle that divide as a clinic owner between creating a systematic approach to assessment versus letting clinicians have their own reasoning and using their own skill base, developing their own professional approach? How do you straddle that tension?
Yeah, well, I think that's the beauty of having data. It just allows you to, for us, we say there's no right or wrong to go about treating anything, or to be able to set, there's no one right or wrong exercise to get someone back to where they want to go. And the beauty of having data is it allows you to have that freedom, and you can just gauge the effectiveness of what you're doing. So the way I might treat someone for a certain condition is going to be very different to what someone else can do. But as long as we can justify and clinically reason, and for us based off reliable, objective data, for me, I think that's more liberating, because I know, as a young grad, I'd come out and I'd think if someone wasn't getting better, it was what I was doing. I'd get them on the table and, with a sore back, and I'd massage them, and I'd mobilize them, I'd crack their back, I'd do the best treatment, and they'd get back up and they'd bend forward still, and they were still feeling pain.
Sure.
Now you can do that, and you can start to measure it and say, actually, you've improved 30 centimeters with your flexion in regards to that, which is something from an assessment that was pretty subjective before. Having that objective data actually shows you, okay, we're on the right path here, rather than just reaffirming that, okay, they're still in a painful state, which it's pretty unrealistic to get someone back to pain-free in sort of one 20 or 30-minute session.
Yeah, sure. No, I love that. And the other question I had for you around clinic ownership and leadership, you're seeing patients, you're leading a team, you've now got this extra thing on the side. And it's interesting, I was talking with a couple of our clients in Clinic Mastery, speech pathologists, who there's a lot of products in speech pathology, speech therapy, apps. How do you manage the different hats? Personally, what have you found helpful as someone juggling clinical, non-clinical, business hats?
Yeah, look, I think technology is a massive part in that. I think for us, we found a few bits of technology that really make our life simple. For instance, we use, from a business point of view, we've moved all our website and all our product-based stuff to a platform called Kajabi. So for us, from a business point of view, it allows us to automate a lot of what we do. So in regards to our whole website being integrated then, with one click into our email marketing, into our opt-in forms, into our product, different product funnels, into our online courses, for instance. So there's lots of different ways that saves us time and allows us to spend more time doing the important things, actually being with the team and, training them and just engaging with them. So I think that's really good. Communication is something we're big on. So we mentioned, obviously, with our app, but we use Asana a lot. We find that that's a really nice platform to allow the team to communicate and to keep everyone on track, setting goals, not only, for ourselves, but also for the team. And we're big on them setting their own goals to work towards as well. So, in regards to, and let them drive where they want to go in regards to development. So I think that's another really, nice bit of technology that we found really useful to help develop them. And then, Google Suite, I think that's another, platform where everyone can collaborate on documents and integrate with your calendars and all those type of things, arrange meetings. So I can work from home as this morning, but still collaborate with the team or with Andrew on certain documents. So you can work literally. I'll be doing that from Dubai in a bit over 24 hours time.
Yep.
And so the beauty, it opens up the world to you, I think. And as we start to look more into virtual consultations and those type of things, I think with technology, it's really going to open up the world to your practice rather than take you from just a local suburb-based clinic to a worldwide clinic.
It's interesting. And let's just touch on that just once more, whether it's, Google, Asana, Kajabi. We've created some episodes earlier on in the podcast around how to use Asana and Google. So you can check back through the episode library there. But even extending out through to your movement assessment tool, you're a clinician, right? We're all clinicians listening to this, and we've happened into becoming clinic owners.
Yep.
How do you integrate technology when you're not a tech geek?
I think it's just persistence a lot of the time. There's a lot of, failures. There's a lot of adaptation. Just, for us, we're quick to adopt. I think, you got to be quick to adopt, but you've also got to be quick to fail as well. Find what works for you and what doesn't work for you, and pick that particular tech and try and stay with it for a little while. Give it a chance to fully integrate. If it's not working, look to change again. But don't be afraid to outsource stuff too. I think that's something that we don't do enough as business owners, is to get other people in as well. And I know a lot of clinic owners and a lot of my friends have opened clinics, say, we just can't afford to do that. I'm like, well, what could you be doing with those 5 hours that you're spending on your zero accounting, or which is 25 hours doing your website, if you could be outsourcing these things to other people, who have expertise in that area too. So don't be afraid to delegate.
Yeah, I love that. And it speaks to something higher around whether it's outsourcing to a VA or just going through the friction of changing to a new software. At the end of the day, if our goal is to create amazing experiences for our clients, then you'll push through the friction and the challenge of testing a new software or onboarding a new VA or whatever that looks like, because it's client experiences that really are the end goal. So it doesn't matter what it takes to get there.
Yeah, you got to, leave someone feeling, you got to walk from the moment they interact with your clinic. You've got to have them feeling this is something different. This is something special to be a part of. So, and I think technology allows you to do that. But even before they come in, it allows you to leverage maybe your skills as a business owner. If you're finding you're having trouble getting people in with, some of your younger or newer staff members, if you often, the owners have the books full for weeks. If you're struggling to do that, leverage yourself in the technology. There's lots of ways you can do that now with, videos before people come in through, technology, which I know you guys are big with, like clinic apps and those type of things. Through our software, there's different welcome videos and stuff where you can leverage your expertise and provide education to all your patient list without actually servicing them yourselves.
Spot on. That's it's very insightful, Steve. Thank you so much for your time. If people want to learn more about you and your journey, or the movement assessment stuff, where should they head?
Best place to head to mattassessment.com. So that's our website. You'll find lots of information on there about our courses, about our journey. You'll also find links to to my podcast, the 21st Century Physio podcast, and the new KneeMatt Pro App as well.
Fantastic. Mate, thank you so much for your time. Listeners, we'll have all the show notes over at clinicmastery.com/podcast. All the links and everything that we've mentioned in this chat, you'll be able to find over there. And you can jump on our free Grow My Clinic course if you want to take your clinic to the next level and create amazing client experiences. Steve, thank you for your time. Listeners, thank you for your earbuds. And we look forward to bringing you another episode really soon.
This is the Grow My Clinic podcast by Clinic Mastery, where we help you deliver amazing client experiences to grow your clinic.